I am Dr. Naveen, consultant physician working and based in Bangalore. I have experience treating GERD for last 10 to 15 years. So today's topic is diagnosis and treating GERD in older adults. So let us start the topic now. So what is GERD? GERD is something like gastroesophageal reflux disease in which gastric content get refluxed into the esophagus. So this is called as gastroesophageal reflux disease. So usual symptoms of GERD are one is chest burn or heartburn, what we call it as, and one more is reflux. That means the contents in the stomach getting back into the esophagus. In older adults, these symptoms may not means this classical symptom may not be there in all the patients. They can be presented with some other symptoms like some food coming, feeling in the throat or mouth, or sometimes difficulty swallowing, and generalized abdominal discomfort. Sometimes they may feel chest pain. It may not be burning. So these are the other presentation of GERD symptoms in older adults. So difficult. There may be difficulty in diagnosis by history. So we have to do some more questionnaire to ask patients whether you have all these symptoms. What I explained, like chest pain, sometimes chronic cough. So one of the presentation of GERD, chronic cough, the two dry cough, they may not produce any sputum. In that case, we have to rule out this condition called as gastroesophageal reflux disease. We can get ECG, other things, or echo to rule out the cardiac. If we suspect, if we want to rule out cardiac cause also for chest pain, we may have to get those things to rule out. And some patient may present with complications also. As we all know, GERD is one of the commonest cause for esophageal cancer, and previous first it will present it as like Barrett's esophagus. That means stomach mucosa replaces the esophageal mucosa in the lower end. So that slowly it's a precancerous condition that slowly gets transformed into malignancy of the lower end of the esophagus. So one of the complication is Barrett's esophagus, that is pre-malignant condition, later on turning it to be lower end of esophageal cancer. Manifestations are sometimes stricture can occur. That is very rare presentation. Due to these symptoms, patient may not eat well, so can end up in malnourishment. So how to diagnose the condition? So gold standard is you have to do 24-hour pH monitoring in the lower end of esophagus. That is the gold standard method to diagnose. But most of the time after doing endoscopy, we may get to see some erosions in the lower end of esophagus or esophagitis. Those things can be made out during endoscopy. So these are all the things to diagnose the GERD in older conditions. So how to treat this case? Usually treatment considers one is medical management and then surgical management. Most of the 99% of the patient doesn't require surgical care. So most of the patient require medical care and lifestyle changes. What is lifestyle changes? Like those who are obese are more prone to GERD. So you may have asked the patient to lose some kilos so that they may feel. And smoking, one of the major risk factor for GERD. And drinking too much coffee, like frequently drinking coffee or some tea, these things they have to decrease taking intake. And some people may take a lot of spicy food and green chili. Those things can be asked the patient to reduce or almost stop the intake. So, and other lifestyle changes like raising the head and of the during sleep and not sleeping immediately after eating also. So they have to walk before sleeping. Better encourage patient to walk after eating for a while, then plan sleeping, especially at night, so that it prevents reflux. And other medications are basically all we know. Previously, we have to decrease acid. which is the only thing which causes the erosions in esophagus and symptom. To decrease acid, we know all know like H2 blockers are there, but potency is less compared to PPA and reflux. We can use some motility drugs like domperidone or metoclopramide. Etopride nowadays very popularly used for those who are having diabetic neuropathy like autonomic neuropathy. So rarely patient may need surgery. So in that case, we can plan surgery also. So most of the patient, like 95 to 99% of the patient will be treated with medically with these modalities. And nowadays, already we know the raft formalities, the formulas also came like so those raft formulas also can be used after the food, like 10 ml 2 to 3 times a day for 1 month, and it's very safe in pregnancy also. That can be used. Other than this workup, as you all know, we can do endoscopy to look for Barrett's esophagus or any reflex esophagitis. Some people diabetic may have some esophageal candida also that can be ruled out before labeling him with reflux. So other than that, lifestyle changes I already explained what are to be done. Losing weight, quitting smoking, eating regularly, not skipping the meal. And oh, one more thing. So most of the time patient will be binge eating. In that case, we have to advise patient not to binge when eating. So they have to eat small quantities of food. So to conclude, GRD is nothing but reflex of gastroesophageal, gastric content into the esophagus. So due to the acid content in the stomach getting back into the esophagus, sometimes cause esophagitis. Sometimes it can go into like trachea and cause chronic cough and some complications like serious is Barrett's and then turning it to be cancer. So those things can be prevented by adequately treating. Diagnosis already told 24-hour pH monitoring of the lower end of esophagus. And that's all. Thank you. Thank you very much.